introduce our chairperson, and he will do the honors of introducing our speakers. So with permission of everyone, I will move on. As we can see on our screen, our chairperson is Dr. Amrit Pattajoshi, MBBS, DPM, MD Psychiatry, and currently professor in Department of Psychiatry at High Tech Medical College in Bhubaneswar. He's visiting consultant in Amri Hospitals, First Hospital and KAR Hospital in Odisha. He has 20 plus years of experience in psychiatry, has 50 plus publications in national and international journals. He has authored 5 chapters in various textbooks of psychiatry. And I congratulate him for his win for his post of General Secretary, IPS National Zone. Although he has, thank you very much for coming here, Dr. Pattajoshi. He has worked tirelessly at the state level, at the zone level, has multiple leadership roles in national and international committees. And the most recent award, which I'm highlighting here, but he has won many, many awards. So his biodata is so extensive that it would take maybe our whole 1 hour if I have to elaborate. So I'm just taking a shortcut. And his areas of interest and expertise are mental health, LGBTQI, consultation liaison, geriatric mental health, suicide prevention helpline, sports and mental health, and then many, many more, because he has been active part of all these committees, and then has been doing pioneering work for all the modalities. So I hand over to Dr. Pattajoshi to introduce our chair, all the speakers. Dr. Pattajoshi, to you.
Thank you. Thank you, Pallavi. First of all, let me thank the West Zone. They've been a pillar of support for me, and I think they played a substantial part in me being this honorary secretary of IPS today. So from the core of my heart, I would like to thank everybody who have been part of this. And this is my first academic event post my victory and installation as the secretary. So thank you so much. So our first speaker is Dr. Meenakshi Martins. She's a consultant psychiatrist, actor, writer, and a social activist based in Goa. Wow, that's wow. She has been in practice for more than 25 years. Chairperson of North Goa's Preventive of Sexual Harassment of Women at Work since 2014. Previously served as Director of Rehabilitation and Drug De-Addiction Center run by Forum Against Drugs in Mumbai. Was on board various commissions for women child welfare. Registered acting career across Marathi, Konkani, Hindi, Malayalam production. Bestowed with various awards for performance, including Rang Saman by Kala Academy, Goa. That's brilliant. The next speaker is Mrs. Sonali Kale. She's an MA in clinical psychology. She is director of the Mukangan Foundation's Nation De-Addiction Center in Pune. She's a certified REBT therapist trained at the Albert Ellis ATC. She has a decade of administrative manager role in a charitable trust, more than 6 years dedicated involvement for parent-child units in the field of remediation and behavior training. Welcome, Mrs. Sonali Kale. And the third speaker, is Dr. Anuradha Sovani. She's MA, MPhil, PhD from the University of Mumbai. She's a psychologist and psychotherapist. She's a trustee and consultant Institute for Psychological Health, Thane. She was formerly a professor and head Department of Psychology and Dean, Faculty of Humanities, SNDT Women's University. She's author of 13 Marathi books, over 70 research papers, guide of 16 doctoral students. Her major projects have been on treatment of schizophrenia, stigma reduction, and addiction prevention. She's also got a lot of awards in accolades, like Dr. R.D. Lele Oration Award of AACCI 2021, Mumbai University Chancellor's Gold Medalist, and her areas of interest in child and adolescent mental health, women's mental health awareness. So with this, I welcome all the 3 esteemed speakers to our program today, and I hand it over to our moderator. Thank you so much.
Thank you very, very much. And I take this opportunity to welcome all the audience. I'm sure that more audience will be joining us shortly. Our webinar topic is quite relevant, that workplace mental health, peace of work. We are looking for peace of mind at our places of work. So peace of work, we are going to take a piece of work about it. And our IPS West Zone Women's Psychological Health Committee welcomes all the speakers, and I invite our esteemed speakers, first speaker being from Muktangan, Ms. Amrita, first speaker being from Goa, Dr. Meenakshi Martins. I welcome you and I request you to start with your sessions, please, ma'am. Ma'am will be talking about POSH Act and other relevant facts.
Yeah. Thank you so much, Pallavi. It's my great pleasure and honor to be here participating in this subject. I'm still not very familiar about this system, so I don't know whether I'm clear or whether I'm visible or not. I really don't know how to do this gallery thing that I was told to do so, because I'm on phone. I'm not on my laptop. So, okay, let me begin. It is very unfortunate. I will have to start with that. Yesterday I was at the police station for something else, and I asked them whether they know about the POSH Act, and the junior police there asked me, what is it? So I said, you don't have an internal complaints committee in the police station. So they said, I don't think so. So I said, can you find out and let me know? So though it has been made mandatory and still understood as the Vishaka guidelines, there are very few people who know that an act has been formulated in 2013 and is in place since 2014. And I was the first chairperson of this under this act for the local complaints committee for North Goa. It is for prevention, prohibition, redressal of sexual harassment at workplace. This act defines what is a workplace and what is sexual harassment. And by now, many people who are attending, which are must be already aware. They must have done a little bit of reading and will be aware what exactly is workplace. We define workplace as organized workplace like government, state government funded, or central government funded, or informal workplace, which are private businesses which have employees up to 10 or even less, or the private sectors. I like to include, we keep harping about domestic servants and sexual harassment therein, which is of course noted, and since there is some kind of awareness, they do come and complain. But large sector, which is temporary labor, which is say like road construction or field labor, they don't have this kind of opportunity, and there is no one where they can go to. So the act basically came into being following the Vishaka guidelines, and most of you will know what the Vishaka guidelines are. But briefly, going into flashback mode, I'll remind you that it was about a case in Rajasthan dealing with Bhavri Devi, who was a Sakhi or Sathi to deal with prevention of child marriages. And she did manage to stop a child marriage of a 1-year-old child. But then, as a retaliation, the people involved indulged in gang rape. Now, it is very essential that a woman has to feel safe in wherever she is working. And a PIL was filed, and those guidelines came into being. And fortunately for me, I don't know when it was, like maybe 20 years ago, way before the POSH Act came into being, I was suddenly put as a NGO, though I'm not part of any NGO, or a social worker on several internal complaints committees across the board, from the collectorate office to colleges and industries and the like. And we hardly had any meetings because there were never any complaints. Now, though it is related to only prevention of sexual harassment at workplace, I discussed and described what the workplace is like. But when we talk about the process of recording the harassment per se, many times when the person comes to us for harassment, it is something mild, like, teasing, enticing a person with rewards, promotions, a good, maybe confidential report, or even promotion or leaves, or the like. When the women come to us with serious offenses like rape, molestation, we usually direct them to the police station and ask them to make a complaint, a proper complaint. When they don't know how to do it, we advise them and direct them to social workers who help them to draft a proper complaint so that a first information report can be registered and a proper, charge sheet is filed against the culprit. But in the scenario of offices, it becomes slightly tricky. And as most of us are aware, the sexual harassment per se can be of two types. It can be physical, visual, touch, showing videos, sending notes, sending WhatsApps late in the night, or pornographic material through WhatsApps, and then in the morning when you confront the person, they usually say "galti se gaya," forward aaya tha and "galti se gaya." I didn't mean to send that to you. But then the atmosphere in the workplace changes and it becomes line, and a lot of things happen which makes a person uncomfortable. Just giving you a brief example, I've had a young girl in a work environment where the person, I am from Goa, so there is a very unfortunate perception of Goan women. And when I joined the film industry, for example, it was automatically construed or understood that I would be happy to wear bikinis or minis or expose. And when I told them that we don't do that in Goa, so I was told that गोवा में तो लड़कियां बिकनी पहन के स्कूटर चलाती हैं. So when I told them that I have not even seen a bikini, then I was ignored. I was not called for auditions, or that is the film industry. So that is a totally different ballgame. But in this, say, government work setup, when a girl is asked, or a private setup, when a girl is asked in Goa, when people come here, they assume that the girls here are, friendly, overtly friendly. They will be open to overtures or open to night outs, or it usually starts with where is a good place to eat. Then it comes with, will you take me there? Then it comes with, will you spend the night with me? And when the girl refuses, and the girl is coming from a middle class background with in Goa, middle class and upper middle class, we have very high values. The working class has very high moral standards. The lower working class has even higher standards, and these kind of overtures are not at all welcome. And then the girl starts cringing and she does not feel comfortable in the environment. Then she's taunted. In one case, one girl was accused of theft. In another case, she was again accused of financial misappropriation. In one case, one girl from a hotel industry was accused of stealing 1 liter of phenyl, and because she had made complaint against the manager. So this kind of complaints, counter complaints come. I'm on the local complaints committee. That means I am in charge of the informal sector, or if the complaint is made against the employer or the head of the department. Now, since 2019, though the act came in 2013 and it was mandatory that every organization should have an internal complaints committee comprising, the senior most female member of that particular organization, whether it is government or private sector or a school, or a private business, where there are more than 10 people. But if they did not have a senior female, they could have always, asked someone else from another office to come into this committee. Plus, there was an NGO representative in the internal complaints committee, and somebody with the legal knowledge or the procedures, because they're all, civil procedures initially, like to send notices or to record the statements or summons and stuff like that. So these things do take time, and one has to be very sensitive about the complaints. I have been specifically informed that I should make a mention that there are false complaints also, for which we have to be very vigilant. I have recently had a extremely manipulated complaint for regulating backlog of leaves taken illegally, which comes under the service rules, which does not come under sexual harassment. But it took us quite a bit of time to sort this thing out. And I don't think you would like to go into the procedure because it's a pretty lengthy procedure. But I would like to say that wherever there is any kind of sexual harassment, and the right of dignity and the right to work, livelihood under the Constitution provided for every single individual. I'm not going into the gender, this is for women, but we have to uphold the right of a person to work peacefully, with dignity and with pleasure and with some kind of reward in a workplace. If the person is going to go into the workplace where there is a hostile atmosphere because a rejection has happened based on a sexual advances or any indication, verbal, physical, or technological, like messages written or WhatsApps or whatever emails, then that woman's right has to be upheld. Many people have said, well, what about men? I think men's rights can be covered under the service rule, or we will have to seriously think about making, an act which is gender neutral. We have not come there. It's a process in the making, and this itself has taken so much time to come through. And every time I think we look at sexual harassment, we are just evolving. In fact, the latest judgment to come from Supreme Court was recently, I think it came in May of last year, and it happened to be a case from Goa in the university. It came back to Goa to be reconsidered and reviewed because it said that there was no fairness in the procedure undertaken by the Internal Complaints Committee of the Goa University. So that judgment of Civil Appeal number 2482 of 2014 is online for everyone to read. And I think the justices of the Supreme Court have given very, very beautiful. Justice Hima Kohli was the person who has drafted this judgment, and it has, in great details laid out the procedure of how we follow. Now, when a sexual harassment happens, and please tell me if I am like nearing my time, okay? So when the sexual harassment happens, that person who is abused or feels hurt, or in a way that her rights have been trampled upon, needs to make a complaint to the Internal Complaints Committee within 90 days. And if she's not able to make it, then her relatives, friends, anybody can make it. Social workers, usually they go for help to lawyers in the legal services centers, or social workers in their locality whom they know. They draft a complaint. We at the Local Complaints Committee ask for copies with a well-drafted complaint, because we need to know when, where, how, who, what happened. And then what we do is we try to get the complaint in its full form with any documents attached to it, like emails, or in one case, I asked for a CCTV footage where that phenyl bottle was stolen, and it was found that it was not, and that there was sexual harassment, and the whole management was trying to, cover it up. And then we asked for the list of witnesses. So I do encourage witnesses on WhatsApp calls also many times, because there are some big organizations where by the time the complaint has been submitted before us and we take it up, though we have 90 days, but sometimes it doesn't happen because we work in the government administration, and people are always on training, leave, and election duties and stuff like that. I don't think I have completed a single case in 90 days. But we do ask for a list of witnesses. If they are transferred, I have encouraged WhatsApp calls and question answers as they happen in the court. So we take down the complaint. We sit the committee members. We have one representative from the Directorate of Women and Child. My member secretary has been always a Mamledar or Tehsildar, I think, in other parts of India, in the collectorate. The presiding officer is the district magistrate, and we form a sort of how to go about the whole matter. We decide what the complaint is about. First and foremost, we decide whether it comes under service rules or it comes under sexual harassment. So many times it is service rules, and then we send them to to be handled by that particular department, and it doesn't come under sexual harassment, like leaves and the person did not sign on my application or sent me somewhere else when I wanted to go somewhere else, and all sorts of things which are not sexual in nature. So we decide that first. And if it is sexual in nature, in any form, if it is a grave offense like rape, molestation, then we encourage the person to go and file a complaint before the police station. And if it is something that can be, decided upon informally, then we ask them whether they would like to go in for mediation or, talking it out and seeing whether we can sort it out without going into the entire process of inquiry and having the witnesses and conducting the whole process, which is exactly like a civil. But here we do not have lawyers, so the people have to represent themselves. We have a steno and to take down the proceedings, and these proceedings, it's normal proceeding like we have in the court, which we call as roznamas, are being written down to record. We keep two different sets, one for the office, which notes down what the committee did that day, and as the chairperson, I note down the proceedings of the matter, like what happened, where if the person has given a statement and what that statement was, and the statement is recorded differently and signed by all the committee members. Then we discuss, debate, and we find out whether the person can sort of come to terms with the situation. And if it is not that grave an offense, like someone just looking at you and passing a comment, or the girl getting hurt by men in the office staring at her, we have asked for a letter of apology. In serious offenses of using bad words, because the girl did not go out with that particular senior,
So Meenakshi, we are at the last minute.
So we have given financial, a fine of up to 5 lakhs. Our report is submitted to the presiding officer, and then the report goes back to the parties. Yep. There have been appeals in the High Court against our orders.
Dr. Meenakshi, Dr. Meenakshi, we are at the last minute.
Yeah, so I'm
at the last minute for your session.
Yeah, you want me to conclude, or I'll close here? I'm fine.
Conclude, ma'am. Conclude, yes, ma'am. Yeah.
Yeah.
So we heard from Dr. Meenakshi firsthand that how the POSH Act and committee works, although it sounds very clerical, but she has been very clear that in 90 days, committee is supposed to be doing the whole proceedings, take statement, understand the victim's point of view, try to find out if there are any false complaints, and act accordingly and judiciously. So I thank Dr. Meenakshi very much for this insights into POSH Act, although it sounds very cumbersome, but I understand it is very friendly for the women to go and approach these committees and make their points heard, and then to get their grievances heard. I thank you very much. And I move on to our next speaker, Mrs. Sonali Kale, ma'am, to enlighten about de-addictions. And it's very interesting, as she said, that we are using the internet to talk about novel addictions as well. Thank you, ma'am. Here to you.
Yeah, thank you. Thank you so much. Good evening to everyone. And thank you, Dr. Pallavi, for giving me this opportunity. So the topic that has given to me is addiction. Now, whenever we think about addiction, we have a figure given by media to us, that is cigarette in one hand and a glass of drink in another hand. And this figure is always of a male person. Till now, or maybe some years ago, we never thought that we would have this kind of addictions in females. In Muktangan, our director, Mukta Tambekar, she always shares this experience. So I would like to quote that here. Whenever we used to have foreigner visitors, so they used to ask us, we can see only male patients here. So where are the female patients? And we used to tell them, we don't have addiction in female in India. But at that time, maybe 10, 15 years ago, we were not aware that we have to face this sometime in the future. So when we say addiction, there are n number of addictions, of course, with the substance. And now the new which is coming up is behavioral, or what we call it as internet addiction. So that is the one which is started mostly from the COVID. Of course, it was there earlier, but it came in light from COVID. So when we talk about substance addiction, it is alcohol, tobacco, smoking, drugs. These are the things that we are aware of, but there are some more substances like medicines, cough syrup. So we have female who are addicted to this also. We had one doctor admitted to Muktangan, or she was the client to me. She was addicted to medicines. Now, see, whenever we say addiction, we have all kinds of reasons. We see addiction in corporates, we see addiction in domestic help, who are maids and all. Also, we have addiction in the ladies who are working for hospitals, who are maushis and all. But all these females have their own reasons for the addiction. Like corporate people, corporate females, they will tell you that we have this culture, so we cannot say no. So there they start with this smoking or drinking habit, which takes them towards to the addiction. Domestic help, or the ladies who are into this cleaning job, they give us the reasons like, we are doing the job. If we don't have tobacco, or if we don't have that mishri, it is impossible for us to stand for the work. And absolutely, we can understand the kind of work they do. It's so disgusting for all of us, that if they want to do that work, they have to have some kind of kick. So whenever they tell us, or whenever they gives us this explanation, we as a counselor, we don't understand what to tell them, or to tell them not to do this. So they say, if we don't do this, then we don't have a job. We cannot feed our family. So it's really a difficult task to bring them out of the addiction, for whatever addiction they have. So I was mentioning the case of a doctor. She was so busy. She was an MD doctor, and she used to have a good OPD along with her operational cases. So at the end of the day, she used to be so fagged up that she started having a glass of beer just for the relaxation. Over the period of time, her body got so used to the tolerance increased, and she started increasing the intake of beer. She shifted to the hard drink. And over the period of time, she realized that I'm not getting that relaxation with the drinks. So she started with the sleeping pills. So when she came to us, the addiction was, along with the alcohol, the sleeping pills. Now we can imagine a doctor who knows everything about the addiction, getting into the addiction. So we in Muktangan, we always say that addiction is always a byproduct of something. So we need to identify the primary problem. If you identify that and work on that, it is very easy to come out of the addiction. But the basic problem is to identify what is my primary problem, which is taking me towards the addiction. So these kind of different addictions, and also addiction does not have any kind of reservations. They don't say that, okay, this is Brahman, I'm not going to go to this, or this is XYZ, I'm not going to go to this. They see everything in equality. Addiction is the only thing which see everything in the equality, I guess. So we have patients from all strata, from all age groups. The least age group what we had catered, of course, on the OPD, because below 16, it is not, we are not permissible to admit the patient. So we have patients from 14 to the age of 70. So this varied age is very difficult to cater, is very difficult to explain them what is addiction. I mean, if I tell you that you have an addiction of tea or coffee, no one is going to trust me. We drink tea and coffee so many times a day. So many times it happens that if I don't get a tea in the afternoon, I start getting a headache. So that is a kind of addiction. But for us, that is a habit. We don't consider that as an addiction. So when we go and talk for the awareness programs, children come and ask us, or even the corporate offices employees, they come and ask us, then why don't you admit people who drink coffee and tea also? Because that is also one kind of addiction. But these are the addictions where this content of addictive substance is not that bad, which is not taking you towards any kind of physical or mental illness. Addiction is substance addiction, and now even behavioral addiction. They had been prescribed as mental illnesses even in DSM as well. So what we try is, we try to make people aware, even in the corporate, in hospitals, in domestic health, how to manage themselves without doing all these kind of addictions. Even I would like to say something about internet addiction, which is the new addiction coming up. This is, again, it's not only with the corporate or those who are using internet. It is all over from housewives, from domestic to the corporate. Now, most of the corporate people, what they say is, even though we are on the screen for a longer time, we are working. So off the screen, once we finish the work, for the entertainment also we need the screen. So that is where your screen addiction starts. We say addiction starts when you stop doing your regular activities and you get into this either substance or a behavioral compulsion activity. So screen addiction is one of the things where we see most of the times male, same as substance. Initially they were males, now we see females. Even in addiction, internet addiction, gaming, gambling, online gambling, most of the times addicted are males. I think since last few months, we have started getting cases for internet addiction, online gambling, about female addicts. Otherwise, till now, it is only social media, TikTok videos, or chatting, sexting, all these kind of things. Recently, last 2 months, I am consulting one patient who's staying in US, and as Dr. Pallavi also mentioned in the start, I am doing this counseling through internet to reduce the internet addiction. So this is some kind of this thing, but yes, it is the scenario now that we have to. Sorry, someone is saying something. Okay, so we have to see that how we can manage. See, in substance, we tell all the addicted people that you have to have the abstinence. You're not supposed to use any substance. You have to be away from all the substances. But in internet addiction, what we try to do is we try to teach them or guide them how to use the internet in a proper way, or how to use the screen in a proper way. Manage your usage, because we cannot tell anyone not to use the internet, because it is as good as necessity for this generation, even for our generation. This conference is also online. We are going to give it on the YouTube. We want people to see this, right? So we need to tell them how you can use it in a proper way, which will not hamper your day-to-day routine, your important tasks. So this lady started gambling. She was working with one of the good corporate IT sector. When she was working with the in her working hours, she used to have her computer on. She used to have, I think someone is, okay. She used to have another screen on, which, yeah. She used to have another screen on, which used to give her updates about the gambling. So at the same time, while working, she used to do the gambling also. Over the period of time, see now all these gambling games or online games, they are designed in a way that initially you win, and over the period of time you start losing money. Am I audible properly?
Yeah, please request Hemant Velsare to turn on the mic, please. Dr. Hemant Velsare, please switch off your mic. Yeah, continue.
Yeah, thank you, ma'am. So we have to see that they are using it, but they are using it in a proper way. Initially, when you start gambling, you start winning. Over the period of time, you start losing money. Now, when she came to us, she had already lost almost 1 crore of rupees because of her gambling. And she's at the stage where now her husband wants to take the divorce because she is not ready to come out of the gambling. She has a son who's 14 years old who tries to tell her how she can use, even if she wants to play, even if she wants to gamble, how she can do it intelligently. So the whole scenario is we see that most of the times children are there engaging into the gambling or online gaming activities. But when we see this case, we understood it's not only children, but there are females also, and she's almost 40 plus. So there are females also who get into all this. She's the first one who came for the help. So we came to know that, yes, there are females also. Now we have started getting these kind of cases also. But then it's really, it's not really nice to share that this is increasing. But yes, this is the fact that these things are increasing. So I think with all this negativity, what I would like to share to conclude the session is, even though these things are there, Muktangan is there to help you all. We know n number of techniques with which you can manage your substance as well as internet addiction. So if you can take this help, if you can go to the Muktangan YouTube channel, if you can go to the website, there also we have small videos which can give you the techniques how to manage your usage and how to be away from the substances.
Thank you very much, Kai ma'am. I'm really appreciate that you gave a lot of examples. Although a lot of our audience is from the medical field, but then it feels far more real for the general population when you give example of real people and what happens to them. So I understand from your sessions that people who are working, irrespective of their job, blue collar job or a white collar job, they are at high risk of addiction patterns. Women are also increasingly at higher risk. Internet addictions are very tricky and very challenging, and then of course people can be signposted the new avenues that using YouTube, but information and then positive addiction methods or positive use of internet for changing their behavior. So I thank you, and I hand over to our next speaker, Dr. Soni ma'am. Dr. Soni ma'am, to you please.
Thank you very much. I've been enjoying listening to my two colleagues here. So thank you for your inputs. I think they were very, very important. I also want to thank IPS West Zone and all my colleagues there, the various office bearers, and Dr. Pallavi, who's been an old friend. I think this is a very, very important issue that we are attempting to address today. What I'm going to try to do in the little time that we have in hand is to not focus on the various issues already raised by my co-speakers, because they were trying to tell us what not to do, what women should not do at the workplace, or what others should not do to women at their workplace, so that women can have peace of mind at the workplace, they can be happy, they can enjoy their work. What I'm going to try and focus on is the positive angles of what we need to do as women, and also what others, our colleagues, our family, our friends need to ensure for us, so that there is mental health, there is mental well-being and peace of mind for the various women in our lives. Let me begin very, very simply with what is very familiar to most of us as mental health professionals, which is the WHO model, which shows us how mental health, physical health, and social health are very closely interconnected with each other. And I'm going to try to get you to imagine these three circles, interconnected circles, overlapping circles, like how we used to do Venn diagrams in school. So you have mental health as one circle, physical health as one circle, and social health as one circle. We will all agree that all three are extremely important. No woman should have to do without any of these three, whether she's young, she's old, it's a young girl, it's a middle-aged woman, a homemaker, a corporate consultant, whoever she is. And there are very, very important overlaps. And it is the overlap areas that I'm going to stress on, because very often we miss the wood for the trees. We look at mental health in a separate silo. So many of us here, being psychologists, psychiatrists, social workers, will just look at mental health and not look so much at physical and social. What I need to bring to all our attention is the interconnecting areas, the overlapping areas. So if you look at mental health and physical health, what the WHO model shows us is that the overlap of mental and physical health gives a woman or any person autonomy. So autonomy means having the freedom to do what I want to do. It need not be just financial autonomy, because we see in so many families around us that there may be money available, but there may not be choice. People may not really have the choice to do what they want to do. I see this much, much more happening for women and for children, because that's how our society is. It is quite patriarchal and it is quite ageist. It is dominated. So the child is dominated by his or her parents. The parents are dominated by their parents. So very often it is a third generation who runs the show. So autonomy is very, very important. And we must pay attention to this, not just to the colleagues around us, but also in ourselves. Do I have enough autonomy? Am I free to take my own decisions? Am I kind of seconding myself in position to other people in my life and putting myself second and not really speaking my mind when I should? Then look at the overlap between mental health and social health. So remember my three circles: mental, physical, and social health. So you have mental health and physical health overlap, autonomy. Mental health and social health overlap, social support. Very, very, very important. And I will highlight that because all the community work that we have been doing at Institute for Psychological Health and at various other NGOs that I work with has all been about support. Offering support groups to people with various mental illnesses, offering support groups to caregivers. I see that the women in these, and believe me, most of the time, and I think both my colleagues, both are working so deeply in the field of mental health and community mental health, will see that maximally the caregiver in the family is usually the woman. So here we are not looking only at women in the workplace, as in a corporate office. We're also looking at women in the workplace, which is her home, because she is the homemaker. And having support in that context is that very, very important overlap between mental health and social health. And then the physical health, social health overlap is control. If I am physically well, and therefore we must encourage women around us and ourselves to stay physically well, whatever our age, whatever our financial condition, because physical and social health is what? Having good connections. We already talked about support. Having friends that you can quickly call if you need help. Having a good, warm social interaction wherever you are. So many, many women in their workplace tend to get very single focused. It's just work, work and work. And there is no time given to themselves, no me time. So control is the overlap area between physical health and social health. So very quickly, to summarize what I just said, you have mental, physical, and social health. Very important, no doubt. But you also have these overlap areas, intersecting areas: autonomy, support, and control. And if we can ensure that the women in our lives, our own mothers, grandmothers, aunts, all the people around us, our sisters, our daughters, and ourselves can have this autonomy, support, and control. But friends, most important, and we are forgetting that intersection at the center. Remember the Venn diagrams we drew in school? There was always A, B, and C circles, and then there was the AB overlap and the BC overlap and the AC overlap, but there was an ABC. And to my mind, that ABC overlap, that center of the entire Venn diagram, is a sense of agency. What does agency mean? Agency is the belief that every woman should have that I matter, that it is important that I should get what I want. I've been working hard for it. It is my right. And others around me who I love should also be able to move ahead and function and progress with me. A sense of agency that I have the power, I am empowered. I can do all these things and I will do all these things. Many women you hear around you must have heard so many in your practices saying, हम क्या कर सकते हैं, हमारे हाथ में तो कुछ भी नहीं है, मैं कुछ नहीं कर सकती. That feeling is not agency. The sense that I will and I can is a sense of agency. I will quickly give you a few references, a few examples from literature, which I think is the next best after mental health. I think all of us, if we love anything, we love poetry, we love reading, we love understanding stories. I wrote a column for a long time for a Marathi publication, a weekly column called Kumpana Bahir. Where did that concept of a kumpan come from? A kumpan is a fence. It's a fence that is there to protect. Okay, so we keep pets inside a fence, so we keep horses inside a fence, so we keep sheep inside a fence. The idea is to fence them in to keep them safe. But very often we build fences around us and then we only can't escape them. So will women come Kumpana Bahir? Will they open the gate and come out if they are given an option? There was a very beautiful story from Hitler from those times when there were the concentration camps. And they found that after the war was over and after the concentration camps were dissolved and patients, the people inside were allowed to come out, the gates were left open, none of the inmates would walk out. That's because they were so mentally attuned to staying inside that fence. कुंपणाच्या आतच राहायचं. And so even if the gates were open, they wouldn't come out. That is what I found was coming alive in the column which I wrote. I used to write stories, examples, case examples, and women would write back. They would write to the newspaper letters, and these were the examples. They would say, when there is stale food in the house, shiri bhakri मला आवडते, मी shiri bhakri khate. Why? Who likes shiri bhakri? Nobody likes stale food. But somebody has to finish it. So it's like, these tastes are developed. There was a woman who wrote, when we buy fish in the house, and this is a very good example, appropriate example for Goa because you get such fantastic fish. She would say, only the head and the tail I eat. The family eats the rest of the fish. There's nothing to eat in the head and the tail. But that is how women over the years tend to shape their tastes, shape their choices. And so we have to bring women outside this fence. Come Kumpana Bahir. I think it's amazing that some of the most visionary writers and poets who I completely look up to, both in India and abroad, have been women writers who have kind of highlighted this. So if you think of our own Maharashtra and poetess like Bahinabai Chaudhary, who wrote such beautiful Grameen Kavita, very, very local and village-based language, rural language. And she used to use these similes, like simile of cooking. She would say, Are samsara, samsara, jasa tawa chulhavar, adi hatale chatake, तेव्हा मिळते भाकर. You have to work hard and then you get food. अरे संसार संसार खोटा कधी म्हणू नये, राऊळाच्या कळसाले लोटा कधी म्हणू नये. So don't run it down. Housework is great. As a homemaker, you're a great person. See, this woman, no education, but she had the vision to tell this to other women, and that also in her songs, in her poems. अरे संसार संसार नाही रडन कुढन, येड्या गळ्यातला हार म्हणू नको रे लोढन. Don't see it as a pressure, as a bonding, as a weight that you have to carry around. It's a gift. So let women around you learn to think like this. Look at the positive. And there is many more lines of Bahinabai which I could quote, but I won't go there now because I also want to tell you about Amrita Preetham. I just have a minute more, I think. She in Hindi wrote the most feminist and amazing poetry. I remember the song, you all must have all heard it, Ambar ki ek paak surahi. बादल का एक जाम उठाकर घूंट चांदनी पी है हमने. So she's free, she's taken a cloud and she's drunk chandni, but बात कुफ्र की है हमने. I have sinned. But she's saying it with great joy. हमने आज ये दुनिया बेची और एक दिन खरीद के लाए. सपनों का एक थान बुना था, गज एक कपड़ा फाड़ लिया और उम्र की चोली सी है हमने. So this is a woman talking about freedom, how she has wrested freedom from the world and she's enjoying it, be it even for a day. So I think to summarize, and if we have time and questions, I would love to share cases. I think I will just quickly summarize what, according to me, are the 5 things that help women survive, not just survive, but also thrive. The first, I think, is belief in themselves, which I said, agency. Second, having multi-track pursuits, because women, particularly women's brains, are cut out for this. We can multitask. So having many things to do. It's not just work, it's also home. It's not just home, it's also my hobbies. Then the third would be a creation of independent spaces. Like I said just now, I would have quoted Virginia Woolf if we had time, but she too wrote of that. And so did Amrita Pritam about Chautha Kamra, my own space. Support systems must have, one must build one's own support systems. Nobody is going to give us our support systems. We have to build them ourselves, and we are good at it. And agency, as I said right in the beginning, the heart of the WHO model, agency. So friends, I'll end there, but if we can ensure that women can have all this at their workplace, wherever it is, at work, at home, in office, in the community, in social agencies, I think there will be the root and the core of mental health. Thank you very much.
Absolutely delighted, Dr. Soni. You do have 2 minutes to quote what you want to.
I have 2 minutes. Oh,
Yes,
great.
you do
Okay.
have.
Okay, so Virginia Woolf also wrote about this beautiful. It's amazing. I mean, it's across the seas. It's 2 different time spaces. But Bahina Bhai, of course, went on talking about, how her own life is an example of how she can live it freely. After her husband died, she has written a very beautiful poem where she said, "Kunku pusala pusala ata urala gondhana. तेच देईल नशिबले आवतन." That is what will invite my future fate. जरी फुटल्या बांगड्या मनगटी करतुत, I still have strength in my wrist. तुटे मंगळसूत्र उरे गयाची शपथ. I swear that I will keep and live the rest of my life for myself. नका नका आया बाया, नका करू माझी किव. झालं माझं समाधान, आता माझा माले जीव. Now my life is mine. And Virginia Woolf said the same thing, that the name of her book was A Room of One's Own. And that's what Amrita Pritam said. Ek chautha kamra hona chahiye. Not kitchen, not bedroom, not living room, my space. Not all of us are fortunate to have a room to ourselves. We have small houses, but we can have room in our hearts where we can say, this is me time and this is my time and I'm going to take it. So that's what I also wanted to share. Thanks, Valin.
Thank you very much, Dr. Soni. And we had absolutely fantastic speakers. All 3 of them have quoted cases, real life examples. And Dr. Soni has just changed this webinar into a lively, I would say, musical experience and a delightful academic as well as now literary experience. And then I would say that is important because that also gives you resilience, that when we have women sharing the space and then actually creating safe space to share our psychological issues via literature, via music, via poetry or common interest, that does give us resilience and then that does strengthen our positive mental health. So I thank you. We do know about POSH Act, how to protect ourselves against the sexual harassment. We do know addictions are going to be a challenges in newer age, newer addictions. And then, of course, Dr. Soni said that we also have to look out for the positive mental health, be aware of all 3 interactions. So I thank all 3 speakers because they have covered everything. Audience hardly has any questions. They are mesmerized. I'm going to request our chairperson to give his concluding remarks for all the speakers in this session, please. Dr. Amrit, to you.
Thank you, Pallavi. Yeah, thank you, Pallavi, first of all, for inviting me to chair this brilliant session. We stuck to times. The speakers, were brilliant, starting with Meenakshi Madams. And, POSH has been in the highlight in IPS now, as you all must be knowing. And things turned into a very, very bad scene. I will not be publicly going into what happened, but then things were really bad. And I think we need to know about the POSH, how to implement it, how a committee is formed. We in IPS did not have an internal committee for the last 10 years. So from 2013, it has been started, and I think will be forming a committee very soon, because as a secretary, we would be doing that. So thank you, madam. Sonali madam spoke a lot about addiction. And in my practice now, I'm seeing a lot of females who are into addiction, and I think cannabis is one addiction which is rampant now, and mainly in female students, the young mass. Forget the behavioral addictions in terms of the mobile and the internet, making reels, online shopping, and now we see another type of addiction that is trying to look like the Korean people are. That's another obsession or addiction I am seeing now. Another madam was superb, the way she's quoted the poetry and all. I think all in all, it was an enriching experience. And in 1 hour, you can't want or have more. So thank you so much. Thank you, everybody, and all the best for your future programs.
Dr. Darpan, please go ahead. We do have last 2 minutes.
Yes, I think as a chairperson of the IPS West Zone Women's Psychological Health Committee, I want to congratulate Pallavi for organizing this great session as a member of this section, our committee. And I'd also like to thank all the esteemed speakers that have taken out their time and our invited chairperson. It's been a very, very great and enlightening session. I would just like to ask the esteemed speakers and the chair, they'd like to give any tips for positive mental health and at workplace, especially if Anuradha Suvani ma'am. Ma'am, there's a lot of thing of handling stress management and positive coping, resilience, or any techniques or strategies, or if you're aware of any policies, or if there are any, psychotherapy or group therapy programs that are done for workplace mental health or assessment for workplace mental health. If any of the panelists, the speakers can let us know, it shall be great. So I'd like to hear your thoughts on these aspects.
Would you like me to take that question, Pallavi?
Yes,
Yeah,
we
I
have
think
last 2
please go
minutes.
I'm
ahead.
sure Dr. Meenakshi and Sonali would also be able to add. I'll just take a minute. I
Yeah.
think that's a great question. Thank you, ma'am, for it. Yes, there is a lot of work happening even within organizations, not just comprising committees or putting together committees for women, but also to bring women into various leadership positions so that they can lead from the front. Because it's different being a passive recipient of all these programs and actually planning them yourself. Also, I find that at every level, right down, and Meenakshi gave us wonderful examples of women at various levels, various cadres, sometimes even class 4 employees. And a case comes to mind from one of the hospitals where their internal committee, I was an external member. And it taught me that one episode, I don't have time to go into the whole of it, but she was actually being recorded at the time when she was in the changing room. And one thing, we tried to resolve it. We tried to punish the person who had done this sly recording by pretending that the phone was charging in that room. But the one thing she said is, Madam, give women more roles. I asked her, हम क्या कर सकते थे और क्या कर सकते थे आपको help करने के लिए? And she said, please give women more roles, madam. I am a cleaner. I was doing cleaning work. But had I had another woman friend in security, I would have felt safer grabbing the phone and showing it to her. I hesitated because all the security were men. और मुझे डर लगा कि मैं फोन पे वो recording उनको दिखा दूं तो कुछ और हो जाएगा. So you see, the whole idea, even in her mind, she was not a very educated woman, but she said that the more you bring women into the workplace, the more I will have buddies who I can go to. So to answer Dr. Darpan, I think that's one area we can do a lot more.
Thank you. Thank you very much, Dr. Soni. So, working more together, women having friendships at work, outside the work, being together, being each other's cheerleaders and supporter is way to go forward. And because all of us are keeping time, I would say that we won't be taking any more questions. But I do thank all the speakers specifically for making time when they had a very, very busy schedule. And I thank IPS West Zone. I thank all the office bearers, all the chairpersons, all the speakers, all the members who have been part of this committee and who have helped me tirelessly. Everyone who agreed to be here, who made time today. So I thank everyone and I apologize if I missed some name, but I'm going to keep time, I promise. So I conclude this with the vote of thanks. Thank you, everyone. This will be
Thank you, Dr.
uploaded on
Pallavi.
YouTube.
Nicely
you,
done.
Dr.
Yeah,
Pallavi.
looking
Thank
forward
you.
to interacting
Yes.
with all of you again. Have a
Yes,
nice
please.
evening.
Yes,
To
Bye.
please.
all of you, Pallavi, and all the speakers, such a joy and pleasure to listen to all of you. And, I think we are the cheerleaders for each other tonight.
Thank you, ma'am.
True,
Thank you.